I think my most unforgettable patient experience was actually, she was just like a 90-year-old woman, like medically kind of boring. She broke her hip, right? Happens all the time. But what was so unforgettable about her was her. I remember, every day going and talking to her, and she would like tell me stories about her life. She'd be like, I remember when I entered the scene, I was the only woman in my office in the 50s, and was like telling me all these really cool stories and commenting how happy she was to have a like mostly female care team at the hospital. And it was really great. And I loved, getting to see her every morning when I was rounding. And I would even find myself like in the workroom at the end of the day wanting to be like, oh, I think I need to go check on her, just because I wanted to talk to her more. And she was, she was just kind of a little spitfire. And, even though she wasn't the most interesting medical case, she was such an incredible person. I was so happy to be a small part of her journey that I'll never forget her.
I think the most unforgettable patient experience for me happened in the ER, which was my first rotation. We had this guy come in with this rash all over his body, and of course I'm going into derm, so I was really interested in the rash. But he ultimately was diagnosed with something called DRESS syndrome, which is a very rare, potentially life-threatening rash. And so it was just really cool to see something that I was interested in and helped in the diagnosis and management of. And I think the most unforgettable part of that story for me is we ultimately discharged him, referred him to dermatology, and once he saw the dermatologist actually messaged me because he had seen that I wrote the note in the ER, and he just commented on how, yes, this patient does have DRESS, it was a good catch, and he, in secure chat on Epic, sent me a little instructive paragraph on kind of the management and workup of DRESS syndrome. So I thought it was like a really nice way for him to teach me and engage with me, and I think just speaks volumes about the people at this program who are willing to go out of their way to sort of recognize that we're interns, we're learning, and to help us bridge that gap for our careers.
I remember having a patient who was an older gentleman. He was also in his 90s, and he was pretty sick from having just worsening of his respiratory disease. And we had a lot of members from different teams that were consulted on him really encouraged that he try and pursue hospice just because of his condition. But his family was very resistant to that idea. And we eventually asked our palliative care friends to come and see him. And they taught me a few things. First of all, they taught me about prognostic humility, because I think everyone was expecting this patient to pass very quickly within a matter of days to weeks, and I believe he's still with us after over 6 months. But they also taught me about really listening to the patient and the family and what's important to them, because I think we have our own ideas about what quality of life means, but this man was super happy just sitting in bed and drinking his Pepsi because that's what was important to him. And I have really tried to remember that and remind myself about asking patients what is important to them and what quality of life means to them.
My most memorable patient experience was probably I had a gentleman come in and he was struggling to walk and was ultimately diagnosed with Guillain-Barré syndrome, which is a pretty rare neurological condition that I'd only previously read about in textbooks. And we essentially gave him kind of all of the treatment, and I worked with a really wonderful neurologist on that case who similarly was just sending me all these really interesting articles, and I broke out my reflex hammer for the first time in how God knows how long. But it was just super cool, and I felt like I learned a lot, and I think that I think we connected, the patient and I, very well as well. And I think what was so fulfilling about it to me, in addition to just the opportunity to learn, was when he was discharged, similar to you, Brandon, his primary care doctor ended up sending me a secure chat, or not a secure chat, a staff message, and said, hey, I just wanted to let you know I saw this patient in clinic, and he just had a lot of really kind things to say. And more importantly than that, what I thought was interesting was he's actually a physician malpractice attorney, and he typically works I guess not on the physician side, on the side of the patient. And he said he never brought that up, but that, you know, like working with me and with our team gave him like a newfound respect for doctors and for the medical field, and that was really touching to me.
I had a pretty interesting patient my last block that actually Nina took over her care after I was finished. But she was ultimately diagnosed with multiple myeloma, which is a malignancy, and she had come in a month prior to me seeing her, was worked up for a kidney infection that turned out to be kind of negative, and they discharged her. She came back, and actually general surgery had seen her and thought something kind of with her muscles in her back was going on, so they ordered an MRI and found this diagnosis. And I think thinking about the radiology and the problem solving, it was nice coming up with a diagnosis. I also had to share the diagnosis with her, but she was really upbeat about it. And I think overall, it was a good learning experience for me.
Yeah, so I think for me, one of my most unforgettable patient encounters thus far actually was somebody that I've been taking care of this month. It's a patient that I have actually admitted to the hospital 3 separate times this month, and it's a gentleman who I have gotten really close with. And I got to know his family, and I called them many times over the phone. He's a 94-year-old who had an abdominal injury and then kind of had multiple hospitalizations as a result of that. And he actually recently passed away a couple of days ago, and I was able to connect with his son and kind of talk about his care. And I think what was so special to me and kind of something that I will always remember is that he was older and he got to pass sort of on his own terms. Like, I'm just so grateful that he didn't have to go through compressions or anything else, and that he got to live this full life that where he was, in his own mind at 94, and he was still cracking jokes, and we had this sort of special relationship, and he was able to, pass in his own time, like, comfortably. And so I'll always sort of remember that about him, and that we have a very tough job sometimes, and we have very large responsibility to our patients, and that's both something that can be really hard and something that's also just really special.